Well, this is something I've been wanting to talk about for a while. And by the way, we keep continuing to grow, and we thank you so much. If you haven't already, please like, subscribe, and follow us. We keep expanding on YouTube, which we have a brand new episode that drops every Tuesday morning at 6 a.m. Central Standard Time. We're also on every other podcast platform, so please follow us there. YouTube, also TikTok, Reels, Facebook, everything same name, Two Generations, One Mic. You can find us and watch some of the clips, the shorts or whatever, and watch full episodes on YouTube. But this is an episode that we talk about a lot because we talk about health issues and things like that. And one of the things you always say is that Americans really don't do enough preventative medicine.
Absolutely.
So we wanted to have an episode to talk about, but the future of preventative medicine. And we're not talking about like, oh, let's do some more pharmaceutical drugs and, make that industry more money.
Right. So this episode, like he says, we're talking about preventive healthcare. And for us, living in Europe and living in the US gives us a different approach to medicine, because it's not only that, I am one of those people that I love medicine, right? Like if you're sick, go to the doctor, boom, medicine. Because who likes to be sick? I don't. And again, I hate feeling like when I'm getting like a cold or something, I just want it to be done with. Like who likes to be sick? Or if you have pain somewhere, who likes to be in pain? Like just give me a painkiller and I'll move on with my day. But so part of us owning our business, me, Andy, entrepreneurial until the end, I decided to open med spa in Madrid, Spain. And one of our business partners is a brilliant doctor. He is young. He looks way younger than he actually portrays, but his specialty is, he's actually one of the top doctors, aesthetic doctors in Europe. And his specialty is not only aesthetic medicine, but regenerative medicine.
And biohacking. He's also a surgeon.
Yeah, of course.
So he's very knowledgeable and all over Europe, and gets asked to speak in a variety of different congresses and stuff about his knowledge, and he's done so much research in this. And so for people that don't know, because a lot of people don't, first of all, you're assuming a lot of people know what a med spa is. A med spa is kind of a combination of what?
So it's a combination of when you go to a place that can get like facials done and like laser hair removal, but you can also get Botox and
hair and nails and things like that we're doing currently.
Yeah, but like more like mesotherapy and like
fat rejuvenation machines.
Yeah, like rejuvenation machines and everything else. So that's kind of like, but you can also get a massage, or you can get relaxation, but you can also get prettier, let's say.
Right.
Yeah. So basically like aesthetic clinic that also meets like medical aesthetic clinic, let's say. So I was very new into all of this. Who doesn't like to look young? But honestly, since all this Lindsay Lohan thing came out, right? She looks great. Donatella Versace, Madonna. You guys are doing something right. Like,
I think that's what you were watching. It was like, what the hell did Lindsay Lohan do? She looks fantastic. And I said, well, maybe she just stopped doing the drugs and the alcohol.
For sure. But I know a lot of you people, and you guys are so stupid if you think that people say, oh, they're drinking baby's blood. No, it's not. There's actually a science behind what's happening and why they are looking younger and not all botched like they used to look. And me wanting to get more involved into that, like I'm not a doctor, but I've always been so I love researching about medicine and ingredients and chemistry and everything about how to improve your physique and your health. So when we partner with Dr. Ivan, he has taught me so much about all this. And I just don't understand how a lot of people are not doing it more. When I talked to him, one of his things I asked him, and he told me he wants to treat healthy people, not sick people. I'm like, well, no, you don't go to the doctor unless you're sick. He says, and exactly that's the problem. And that's the American mindset. And that's, I guess, also in Latin America, that's the mindset. You don't go to a doctor unless you are sick. But what happens when you prevent your body from being sick? And that's what he is a very big proponent of. Dealing with your body, treating your body like a perfect machine that it is, and helping it not to get sick, which in a certain way we all do, taking supplements, right? We all do. We all take supplements and vitamins and everything. But sometimes the way that we take them, it's not the best way for our body to actually absorb those extra vitamins or nutrients and things like that.
Yeah, one of the things that I really like about the concept of biohacking and what he's told me and what I've read a little bit of that is that you're allowing your body to help heal itself, help rejuvenate itself on a cellular level. Mm-hmm. So you're stopping some of the aging process and the degeneration of some of the cellular level things and rejuvenating those and breathing new life into your cells and you letting your body help heal itself, help rejuvenate itself and help it grow. And I think that's a fantastic thing. And when you're talking about the new science and of using peptides and things like that instead of just using pharmaceutical drugs to heal everything, I think it's fascinating.
So what are peptides? And I know I usually don't read, but there's a lot of terms that I don't remember on top of my head. But so peptides are smaller versions of proteins, right? Our body actually work like the easiest way to understand what it is I know we all know about this, like Ozempic and Wegovy and all these drugs, weight-losing drugs. They are peptides. And what they're doing is they're hacking your body into thinking, for example, these GLP-1 drugs specifically, that you're fuller, that you don't need to keep eating. And it's literally hacking your stomach into thinking, I don't need to eat more. They make you nauseous if you overeat. So that's a way to put it out there. So peptides, what they do is they basically help you on a cellular level, like you said, to improve different aspects. There are peptides to help reduce inflammation. There are peptides that help you with slowing the aging process. And there's some of them that help prevent the cells from self-destroying. And some of them to help the cells become, let's say, better on a way. So one of the things that we are actually taking is the NAD plus.
Yeah,
right?
That's a big. So NAD plus is a huge thing in Hollywood. I know that from the Kardashians, Justin Bieber to Madonna, everybody's taking these IV treatments, like a really expensive IV treatments, and they're calling it the fountain of youth because it basically stops the aging process, they claim, and they say that it totally rejuvenates their body.
Absolutely. So what is NAD plus? Actually, a lot of people, like you can buy that on Amazon, but what the doctor was explaining to me is like when you take it like that, your stomach acids completely destroy the molecules, and it's only a minimal part that your body is absorbing. So to actually see results, it takes years and years and years, if any. So it's kind of like
by taking pills.
Yeah, by taking pills.
Because they're just getting dissolved in your stomach acids.
So it's kind of like a placebo effect. But one of the absolute benefits that I think, and I've seen on ourselves, because me and my husband, we just put ourselves through it, like lab rats, right? Like we told Ivan, like, what can we do? We're going to take it all. And we've been on this peptide regimen for about a month, right?
Almost 2 months.
Almost 2 months, and I can tell you guys, it's absolutely amazing to the fact that I don't get hangovers anymore.
Yeah, you don't get hangovers. You have me on a variety of things from like my joints. My knees don't hurt, my shoulders don't hurt. I feel like, and they did because you start getting age. You start. I work out a lot. My shoulders would hurt, rotator cuffs would hurt, my knees would hurt going up and down steps. They don't really hurt anymore. I worked out really hard yesterday, and I'm not even really sore today at all. It's a whole different thing. But you have me on a variety of things like that, and I feel fantastic.
Yeah, and I'm telling you, I always say, oh, I hated you for not getting hangovers. And now that I don't get them, oh, it's such a blessing. I mean, not that I want to drink more, but actually I think I'm drinking less because it actually doesn't make, I don't get as drunk as fast. Kind of like it's my liver being like super liver right now. Like
Welcome to the club.
I know. I hated you for that. But you do get drunk. I'm not getting as drunk.
Right.
And
But I don't still get a hangover.
right, like yesterday, I had a beer, then I had white wine, a glass of white wine, and I had a glass of red wine.
You had another beer in between that.
Oh, I did? Okay,
and then you
I
went
guess.
back to red wine. I'm
And-
like, I even said, you're mixing a lot of different things here. You're going to get sick.
I was perfectly fine. And this morning, I woke up like Cinderella. Nothing. Like, I was like, how am I not getting, you even said, like, how are you not getting sick? I'm like, I don't know. These peptides are amazing.
Yeah.
But we also like are taking them not only to not get hangovers, but to literally help your body regenerate the way it should.
Yeah, and you also mentioned before in another episode about your mom having to go through cancer treatments like that, and she was on still fentanyl patches.
Right. So my mom has a degenerative disease. It's called marble bone disease. So her bones are brittle as glass, and they do not like if she has a fracture, it can take up to a year to solidify. So her hip joints are completely gone. And there was a point where, I mean, she's not that old, she's 71, but with this disease, there's really no way she could get a hip replacement because her bones couldn't handle it. And there was a point where she could not walk anymore without being in really, really bad pain. And I remember she told me, I don't know what I'm going to do. I said, Mom, let's see what can be done. And I took her to different specialists, and they all said, we can't do anything but just control the pain. And normal pain medication was not doing it for her. So I took her to pain specialist, is called, which he put her on, and several doctors agreed. He had to be wearing fentanyl patches.
She had to wear.
Had to wear fentanyl patches for forever, basically, if she wanted to just walk, because that was the only thing that was gonna keep her from just staying in bed. And she was on those for about 2-3 months, and she wasn't happy about it. I was, because my mom on fentanyl patches, she was like a dream. Like, she wasn't messing with me. She wasn't being like the Latin mom she is. But I understand she didn't want to be like all drugged up. And suddenly she was crying to me, saying basically she was a drug addict now. I said, Mom, it takes more than that to be a drug addict. And I said, if this helps you, let it be. Like, why do you want to be in pain? Just keep wearing your patches. And they actually upped their dose on the patches. And that's the point where she said, I don't want to do this anymore. And talking to the doctor, with our doctor, Ivan, I said, can we give her the peptides? And doing research and everything, I put her on this peptide regimen, right? Like we did at this point in her life, what else she has to lose? Her bones are almost gone. She's on fentanyl. Like, what else she has to lose? And I said, Mom, I'm going to be giving you these intradermal shots, like insulin shots, that contain a lot of these things. Please help me take them. she was like, I'm not going to be taking any more drugs. I said, no, they're not drugs. They're like peptides. And I went to like with her in a lot of different clinical studies. I showed her and everything. And she was like, fine. Well, 1 month in, she's off her fentanyl patches now. She's real happy about it. The pain that she feels, it's tolerable enough that if she takes some normal pain medication, she will be fine. But everybody looks at her and they say, wow, you really look way better than before. And you even say that.
Yeah, and I thought it was shocking. She's actually running the Ironman this year. So I thought that was a really remarkable transition. But
So stupid.
no, but it truly has been a night and day difference from where she was to watching her struggle in the kitchen to just stand up, and now she's moving around. She's liking the peptides and what they're doing for her. It's really kind of refreshed.
She's even going out. Like,
yeah, it's like I've never seen that before, because that was another thing we always had said, like, Mom, you got to get out and meet people. You can't, her thing was she wants to eat breakfast at 11. She wants to eat her dinner at 3. She was in her pajamas at 4, and that was her day. And now I'm like, where is she? It's 5:30. She's going to school. She's going to classes. She's learning English. She's learning computer. And then 5:30, she's down at the new wine shop having wine and cheese and talking to people. And I'm like, it's like a whole new person in a matter of less than a couple of months with peptides. It's really staggering the difference in what's been accomplished.
Exactly. And for me, again, it's just 3 of us, right? Taking them, we all having like different benefits. But for me, looking at my mother that was on this extreme painkiller, right? And where nothing else was left to be done. To me, that was the wow factor. And I'm like, I'm going to keep doing this.
So what does the NAD Plus actually do for you? What are the benefits?
So the benefits are basically, NAD Plus is a form of vitamin B, basically. And what it does is it helps the cells like live longer with less damage. It helps with immune function. It helps with cognitive function, like so your brain cells also don't decay as fast. It also helps with cardiovascular health, muscle function and recovery. So when you're working out, that's why you don't feel as like tired and everything. And it has also anti-inflammatory, but also helps your skin look more vibrant and less tired all the time. So that's one of the things we're on, right? The other thing we're on is the glutathione. Glutathione is one of the master antioxidants that also is great for detoxing the body. And I think that's why I don't have a lot of hangovers anymore, because I just don't, our body detoxes way faster than normal. And it also raises your immune function. So that's why we haven't gotten sick.
And what is the nose spray that we're doing?
Oh, we're doing a nose spray. That's a nootropic. So it's a peptide called P21. P21 is actually, when I say nootropic, is because it affects on a brain level. What it does, it helps the neurons to do better syntaxis, which is the better communication with each other. So it helps you to focus more, to have better memory, and also helps you, and there's studies about it, that it helps prevent Parkinson's and Alzheimer's disease. So again, it's all about the preventive healthcare medicine.
Right.
Like, what if we all be doing this? But it's not convenient for Big Pharma, is it?
Yeah, no, Big Pharma doesn't like this at all, because if you're taking peptides and things that make your body help itself, you're not buying their drugs.
Right.
So they're big. Anytime you see these, what's going to start happening is you're going to see, mark my words, because they have most of Congress in their back pocket, is they're going to be doing, oh, these things aren't good for you. Anything that's taking money away from Big Pharma, you're going to start seeing pushback from from Congress and different things because that's who's paying them to keep their drugs flowing. And so I would see pushback on this. But again,
Well, it's what happened with weed. Didn't that happen with weed?
oh, absolutely. Of course, why do you think weed's still illegal in Texas and a bunch of other places? Is because, Big Pharma doesn't want that to be legal because then you're not buying their drugs.
Right. Didn't they started like that campaign a long time ago?
Yeah, so that and the racism that had to do with, Mexicans and everything else. That was a whole racist bunch of bullshit with the weed. That's one of the biggest examples of Big Pharma
Getting involved
and, and paying off politicians to keep things illegal. Which is just stupid. But anyway, the peptides, I'm on a bunch of different things that you have me on. I feel fantastic. You have me on a variety of things that help.
So you are taking NAD+, you're taking glutathione, you are taking actually resveratrol too, resveratrol. So we all know resveratrol from the thing that comes from the grape seeds, but it's actually a great antioxidant, and it helps you also like prevent aging and cell decay. So we all know, like one of the things that make us sick the older we get is that cell decay and our cells not regenerating. And actually all this, for example, the NAD+, our body has NAD+, but the older we get, the less we produce. Just like we've talked about, like testosterone, right? Like the older you get, the less testosterone you produce. Women, we have also like hormonal issues. Like the older we get, the less hormones we produce. So that's what makes us sick at a point. Our joints, our bones, right? Osteoporosis. You guys, the older you get, the less. And I say you guys because I also have my mom's disease, unfortunately, when we produce more calcium than we should in our bones. But most normal people, the older you get, the less calcium you have in your bones. And that's why you have fractures and pain and everything else. Our joints don't regenerate. The more we use it, the less they regenerate. But because our body stops producing this kind of peptides that made out synthetically can help our body when we introduce them to our body to boost those functions back into place.
And what's the deal with the copper peptides?
Oh gosh, the copper peptides. So this is one of the most amazing things. So GHK-CU, it's called the copper peptide. That has been used greatly in skincare products applied topically. But when you take it in a small dosage, it helps with skin elasticity. It helps with moisturizing the skin from inside out. It helps to strengthen the collagen network in the body. So that helps with joints, like our bones and joints and everything need collagen, right? Like hair, nails. When you take collagen supplements, that's basically what you're doing. You're boosting your overall joint function and hair and nails. But also helps, improving the collagen also helps us to smooth out the wrinkles in our face. But here's the best thing. So it also promotes rapid cell growth. There's this clinical study that has several clinical studies where they find out that applying copper peptide topically onto the scalp, it helps reactivate the dormant hair follicles. So for people losing hair, it's such a blessing. I don't know why more people are not doing something about it. Like it's like minoxidil, but without the side effects. Like why are we into this path where nobody's doing better alternatives than really heavy ass drugs with a million side effects?
Right. Well, that's why I guess. So the copper peptides. That's why I guess you're using them in some of our female skincare products as well as our new hair care line. You're using a new hair care line that we're about to launch. You're using some of these copper peptides and using some of these things infused into these more natural products that we're putting.
Right, because the copper peptide is one of those peptides that actually apply topically. Mm-hmm. It can help. Like NAD+, a form of NAD+ will be niacinamide, and we all think niacinamide is one of the best ingredients now on skincare, right? Like niacinamide is great because it helps your skin. It helps with a lot of like problems when it comes with skin. So internally does something else, just like the copper peptide, right? Like internally helps you in a way. Like you're taking it and people are telling you your skin is glowing.
Yeah. I'm also the guinea pig for whatever else you're trying. We talked about this in product development. This is why the last couple of days you've been come here real quick, and I stand there and all of a sudden you're spraying something on my head and it's all wet and you're rubbing it in. I'm like, what are you doing? I'm checking the copper peptides and we're going to take pictures and see if it's growing some hair. Because if we can regrow your hair, we're going to be trillionaires.
Hey, if this man can regrow some hair, I mean, you guys are looking at it right now. We'll see in like 3 months how that looks.
Yeah,
but hey, if it's not you, babe, who am I gonna test it? You're my test subject.
I'm the test subject.
You're hey, no, I'm doing it too.
Yeah. Well, we are testing the peptides, and those do work. They're I feel fantastic, and I've had so many people say, "What are you doing? This, that, and the other." And yeah, I'm telling you, this works.
Now you have to be careful because there's a lot of bogus companies out there that are trying to sell you bullshit.
And again, if you're the biggest way to figure that out is if you're taking it in pill form. You're just taking nothing because it's going to get digested in your stomach acids and you're not going to get the benefits of it.
But also, like, I understand here in the U.S., it's a different way to get them. Like, yes, there's some clinics that actually there's some doctors that are proponents of peptides, but it's like really down low because oh man, big pharma doesn't like that. And it's hard, but like there's so many doctors really, really diving into this form of therapy. And it just feels like the Dark Ages, right? Like they were trying to really do something for it, but then, oh no, that's like against religion or whatever they said back in the Dark Ages, that doctors were like devil practitioners or something like that, and they were like being prosecuted. This is like something that they're developing and not developing, but researching into that actually can help a lot of people. Like thymosin alpha, right? Thymosin alpha is another great peptide that for cancer patients, it helps you get rid of the, it boosts your immune system when you're taking chemotherapy. And I wish my mom, when she had chemotherapy, I would have given this to her. But back in the day, like there was nothing for her to get rid of all that toxins, right? The chemotherapy. Right. And the chemotherapy is at the end poison. You're poisoning your body. Right. Well, what thymosin alpha does for cancer patients, it helps their body detox, and it helps them to get rid of all that poison, and also improves their immune system because when you're in chemotherapy, anything can kill you because your body's so down to nothing and it is like HIV patients, right? Like anything can kill you. Your immune system is suppressed. Right. So what thymosin alpha does, it raises your immune system, and it's been proven great for chemotherapy patients. So if we will do more investigation and less big pharma paying Congress, maybe we could.
Yeah, see, again, because what you're saying here is that all these things we're talking about, peptides, are supplements. They are not regulated by the FDA.
Right.
And,
because it's things that are in our body already.
Right. And so that's why, Big Pharma is going to step in, and you're going to say, Congress, well, mark my words, Congress, we should start regulating these and everything, because Big Pharma is going to get pissed because you're not buying their drugs and keep poisoning yourself with them and their million side effects. So it's like the peptides and the natural thing and using things in your body, I think, is a great thing to explore. And again, Europe's way ahead of the curve, like they always are, and really interesting things that we're finding out there that I think are pretty fascinating. So we could talk about this for days, and as
but that's
we learn
the key,
more,
like we said, the key.
Yeah,
preventive
medicine.
Healthcare.
Yeah.
It's easier to prevent a disease than treat it when it's too late.
Yeah.
Like what happened with your cancer.
Exactly.
Right?
Well, please like, subscribe, and follow us. Brand new episodes every Tuesday morning, 6 a.m. Central Standard Time on YouTube for the full episodes, and then also on every other platform that's podcast platforms. And then also follow us on all the other social media sites from Facebook, Instagram, and TikTok, all at 2 Generations 1 Mike. You can watch all the little quick clips and even YouTube shorts. We have a bunch of different things out there. Please follow us and engage with us, and we'll have more things to talk about.